The Philippine Nurses Association of Nevada now brings you FILIPINARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, good evening to you, FILIPINARS listeners and followers. How are you all doing? It is time again for our podcast, bringing you information on health issues and events in our community and beyond. This is Doris Bauer, the current president of PNAND, or the Philippine Nurses Association of Nevada, and I'm the host of the program. So we are still coming to you from PHLB radio, but still through a remote broadcast to conform with the social distancing guidelines during this COVID pandemic. We hope you are all healthy and staying safe. And I just want to give a quick shout out to actually my high school buddies in the Philippines who apparently watch this. Hi guys from Sacred Heart School, my old buddies. We got Clarita, Andrea, Edgar, and Santiago and Salve. Hi guys. Okay. So that's a long way to, for this broadcast to be reaching, which we're really glad. Okay, so we are still in the midst of this pandemic, but we see communities reopening little by little. And on the other hand, we are getting news and evidence of a second wave of the virus, the COVID-19. It may seem difficult to imagine that our community or what the world will look like when we all get through this. But we will get through this. It has affected our way of lives, our jobs, our relationships. It has also affected healthcare insurance. Healthcare payers face an unexpected conundrum, and for so many reasons. Insurance payers, though, have been doing their part to support the health care providers, the patients, the unemployed, and also their employees during this pandemic crisis. And actually, this pandemic has caused havoc on our healthcare systems. And health plans are adapting their operations and they are responding accordingly. So today we have invited a guest who can talk to us about this very important topic, how COVID has affected or impacted health, insurance, and medical management. And we're pleased to welcome a nurse first off, but she is the Vice President of Operations of Medical Management of Southwest Medical, a part of Optum. Please welcome Ms. Diane Smith.
Hi there. Thank you for inviting me. I appreciate it so much, Doris.
Oh, sure. You are the person who we need to talk to about this, right?
Well, I hope I can answer some of your questions.
Oh, yes, I'm sure you can. So Diane, can you tell us about yourself a little bit?
Sure. By trade, I'm a nurse. I'll always be a nurse, even though I've been working in a capacity of administrator for a very long time. I work for Optum Care, which is part of United Healthcare. It's the clinical arm actually for United Healthcare. It's actually one of the fastest growing healthcare parts of the organization in the United States right now. Southwest Medical was actually the first organization that United purchased that really started creating Optum Care. So it's been an honor to be part of the Optum family, so to speak, going forward. Optum Care allows us, from this nationwide perspective, which has been very helpful during this COVID event, to share amongst other care providers all throughout the country about what is happening and how to best serve. So it's been a very interesting time for us all. I think we're learning the new normal and what new normal is going to look like for everyone. But it's a flexible, fluid moment at this point. So anyway, that's a little bit about Optum Care. Just so you know that the medical management department mostly serves our senior members. So we have about 57,000 senior members all in the state of Nevada, both in northern Nevada and southern Nevada. Majority of our membership, of course, is in southern Nevada. It's the biggest county in Nevada. I have the honor to work with many nurses who do both case management, utilization management. I also get to work with Southwest Medical 380 physician practice in order for us to create programs that will help our senior members. So it's a job that is something that delight to come every day. Despite obstacles we may encounter, it is an interesting position to be in.
Yeah, that's a very big job you have. So for joining us today. Good. And thank you to Lisa Gamboa, who's part of your team, to help me. And she actually helped me facilitate me coming over. So thanks, Lisa. I'm sure you'll hear this later. Okay. So Diane, let's. How has the COVID pandemic affected Optum or United Healthcare, and maybe other insurance payers, if you can, attest to that, or with regards to authorization or benefits, elective procedures, and members who have lost coverage because they have lost their jobs?
So it is one of the most trying times for insurance as well as our community, right? Because our community is so driven by the casino industry that it has created some unemployment concerns in our community. But Optum worked really closely with the governor's office, Dr. Macbeth, our president of the local care delivery in our regional in Southwest United States, was the only physician that actually sat on that governor's panel to talk about COVID. And he did that not only from a physician perspective, but he also did that from a managed care perspective. He worked with the industry here, the hospitality industry, when it came to the insurance, to see what we could do to really assist during that time period, especially the first 30 days when it became quarantine kind of issues for most of the community. But unemployment is going to be an ongoing challenge for the rest of the year for us, right? Even though the casinos are open, and that is very helpful for our hospitality community. As we know, the hospitality community affects the rest of our community. So for the insurance, especially for our seniors, and I'm really only speaking to that area of the organization, Medicare came out with really specific and I thought really innovative guidelines that help the industry in general. Some of those were reduction of copays to the patients, and we honored those. We honored the reduction in qualifying days for certain kinds of outpatient treatment, like skilled facilities. That wasn't a qualifying requirement anymore to be in the hospital. And we have all the way through July, and I'm sure we'll look at it again, have also looked at extending exhaustion of benefits, because it's been very difficult, not only from the hospital side, but from the skilled nursing side, to find appropriate placement for people, with the scare of really understanding, is COVID negative really COVID negative, or will it be positive later, and all those concerns around that piece of it. So we've extended, lengths of stay in many of our facilities because of that. And, I know that there will be financial impact on the short run, but on the long run, it's really helping our community in general. And that's really a focus for us with Optum. Mm-hmm. The other pieces that we really looked at were how do we treat patients, because we're a healthcare organization at the heart. And so for our clinic areas, for example, we really worked with the physicians, the clinical staff, to determine what could we do to really continue to serve the membership, but yet make it safe for everyone. And Southwest Medical is one of the first organizations to open up FURI clinics. So FURI is F-U-R-I, which is fever, upper respiratory infection clinics. And these clinics allowed members to actually book appointments, stay in their car. A member came and tested with them, or a physician came and worked with them on their treatment plans. So they did not have to come into the clinic. They received treatment really quickly, and we kept our employees really safe during that time period because we had a select group of people that we worked with appropriate PPE to serve that community. The leadership, Tony Corbin being one of those leaders, I've probably heard her name in the community, certainly Dr. Rhodes, Dr. John Rhodes, who's president of Southwest Medical, they spent a very short period of time to figure out how to pull these clinics together and then how to really get the word out. And a lot of what we did was, a lot of phone calling. We have a 24-hour telephone advice service. That telephone advice service tripled their phone calls starting
Wow.
March 12th, starting about March 12th, all the way through about mid-April. We had triple the phone calls that we normally had about what do I do? How do I get tested? What can I do? And we worked very closely with our clinics so that we could give direction to them. And that was a really interesting time for us because we were learning at the same time we were giving direction because we were all learning during that time period. So those were, some of the really quick things that we did. And I know that we're going to talk about some more specific things here in a second, but those were really the quickest things that we could do to mobilize to really help our community.
That's pretty awesome. I never heard of the Fury Clinic, and so that's wonderful. Is it still ongoing right now?
It is still ongoing. We have started reopening. We had I think you'd asked me previous to the broadcast. What did we reduce some clinics? We did. We actually reduced some of the clinics, closed a few of our smaller clinics, and mobilized those providers to larger clinics, as well as to these Fury clinics. And although right now we are slowly opening those clinics because patients are telling us we want to definitely have face-to-face visits with our physicians.
Right.
We'll talk a little bit about telemedicine too, but still have face-to-face, visits with our patients. At that period of time, we really reduced that down so that we could start working on telehealth so that we could provide that safely. But during that time period for the Fury clinics, we learned from our New York and East Coast local care deliveries through Optum to say, here's mistakes we're making every day. Let's try to get ahead of those mistakes. Let's try to figure out how you can treat people but keep your employees safe. And I'm happy to report that for the most part, the majority of our employees have stayed safe because of some of the measures we put in place. We had one provider who actually was COVID positive and ended up in the ICU, and I would like to thankfully report that he is now home. But there was a period of time for almost 3 months he didn't get to see his family or his children, and we're really living in an isolated way in the hospital. I mean, certainly the hospital personnel will do everything possible to try to make people comfortable. You know that. As nurses, we would do that naturally, right? But still, it's not saying your children, your wife, your family members. That's a really isolating event. But happily, he has returned safely to home during that period of time. Some of our other employees, then it was very few that were COVID positive, either had very minimal symptomatic problems, but we were able to isolate really quickly. So those were some of the advantages of being with this very large national corporation that, probably, in a very small office setting, people were trying to learn as fast as they can. And we had some data really quick up front, what was happening nationally to really help us with this Fury clinic decision.
Yeah, it definitely has made us look at all our processes, and we've all learned to adapt. So difficult at times, but it is what it is, and I think we're getting through this quite, nicely, maybe here in Nevada at least, anyways.
Right.
Right. Oh, okay. So I know you've mentioned some challenges. Have you had any challenges with your patient visits or providing for, I know you mentioned a little bit about office closures, which, is fine. What about provider PPEs? You guys have a challenge on those?
So I think initially there were some challenges around getting patients to understand that this was a nationwide, worldwide, serious concern. And a lot of the information that patients were getting were information from friends and family, but also, it has been an ongoing topic for the news, and the news does not necessarily always portray what are the good things that we're doing in order to help people. So we had a lot of misinformation about masks, a lot of misinformation about, how to be seen. And one of the pieces that we did is, as people were coming to the clinic, if they were reporting any kind of symptomatic, we were stopping them at the door with people that were in appropriate PPE. So they had head covering, they had goggle covering, they had mask covering, we had gown covering. So those were just the minimum PPE requirements. And they also had face shields during that time period. So these were folks that were standing out in the heat outside in office areas, and they were really taking it very seriously. Any patient that came to the door, we also had to test for fever. If there was any fever symptomatic, those patients were then redirected to the Fury Clinic. So there was a lot of angst with the patients about how am I going to get treated, and this is very different. And then providing them masks as well. But for the PPE perspective, I have to give Dr. Macbeth a lot of credit for what he did for it, not only here in Nevada, but he's responsible for New Mexico and Utah and Colorado as well. So all of those Optum areas, we worked with United and we worked with Optum nationwide to actually create a stockpile of PPE that was going to be necessary for the clinics. PPE was also supplementary. We had to do supplementary PPE we have a hospitalist team that goes into many of our Valley hospitals, and we have a skilled nursing facility provider team that also goes there. And we had to do supplemental PPE to our employees in that area because those environments were also struggling with, do we have enough PPE? How are you going to do that? We also put a lot of work in how do we safely, through CDC standards, create documentation, and we did video productions for our employees of how to reuse PPE. And that was something that was, for me being a nurse and having to been in that infection control role many times in my life, it was like, what reuse equipment? That, and there's not an autoclave, and we're not and it was very difficult for our physicians too. But we literally put a website out there to all of our employees. And on that website, they could look at videos. We also then included with any of our PPE equipment, they had a reuse policy, and then a policy when there was no longer a shortage. And our shortage is much better because we're not using as much PPE because we don't have as many COVID cases, but we are still doing the reuse piece of it and doing that safely. And I think that was really helpful for our employees to keep them safe during this time period. And I think I have to give a lot of credit too to, again, Dr. Macbeth for really, thinking sort of outside the box and saying, we got to get on this, we got to get on it quick, putting resources there to allow us to be able to do that, and then holding leadership accountable. He made sure that each of us that were in leadership, we were accountable to assess our employees, make sure that our employees were safe, that they understood, that we were very transparent. And I think I have to give Optum in general, I'm really proud to work for the organization during this time.
That's really good. Not much challenge there. You were able to provide your voice, which is great for you guys. Some of the smaller companies though still had, challenges. So I'm so glad. What about, let's say, I know within this COVID pandemic, telehealth has really come to the forefront.
Yeah.
I know you've had some telehealth programs before. How has that changed, and what aspects of medical management do you have telehealth for?
So, this is really interesting because we've had what's called a now clinic, an on-demand clinic that's been part of, if you're part of our insurance, you can actually dial in, use your phone, and you could literally have the phone in front of you and have a conversation with certain disease processes with a physician at like an urgent care copay. But our seniors, that wasn't necessarily their first option for healthcare in general. So so there was a lot of innovation around this piece of it, where we saw obstacles before COVID really, in this time of crisis, we became very innovative with telehealth. Not only us, but other companies in the healthcare community. But we expanded many of those clinics that we had taken providers from, and we taught them how to be telehealth providers. And it sounds really kind of like, what do you mean you taught them to be telehealth providers? But, if you're not touching, feeling, and putting your hands on a patient, and you're relying on this one-to-one video kind of piece of it, you have to do some basic training on how do you look differently at a patient, right? So we had to do that, and we went from telehealth visits during this really difficult crisis to, in the hundreds to in the thousands with our patients. And what we did with the seniors in order to get them on board is, if we could not work with them for somebody that had smartphones, and all of our seniors at this point, many of our seniors at this point have smartphones. So it's a matter of adapting and getting used to that piece of it. That we did two things. We did this video telehealth kind of work with our patients, but we also did audio telehealth with them on the phone, including outbound calling to them to make sure that they had prescriptions completed. We did a lot of outbound calling for patients coming out of the hospital, which we do normally with our processes, but we also set up telehealth visits with their primary care physician, so they felt connected after they left the hospital, or if they left the skilled facility, to be able to do that. But we also had to look at some innovation of inpatient. And I'm really pleased to say that our skilled nursing providers that went out, they went out when some of our skilled nursing facilities were just learning how to manage this process. And it was very different for some of those skilled facilities than they'd ever dealt with before. And yeoman's job to everybody that did that, but mistakes were made, and they had to really kind of re-look at that and work with the state of Nevada to make sure that our partners in SNF were doing a good job. In the meantime, our skilled providers were like, I have to go see our patients. I have to see our patients. So we fitted them with PPE and make sure they had, we actually have now something called trunk supplies for our providers, and they have a box of trunk supplies that they need in case there's not adequate PPE. Made sure they had some initial training with that. But we also worked with facilities to provide an iPad for them at the facility, and they actually taught some of their CNAs to be the telehealth projector person who actually signed in, did the work with us through apps that we used, and that were secured apps, so that we didn't get into any legal issues from the securities perspective. And that all happened actually over a weekend. And during that time period, over that weekend, that next week, we went to total telehealth visits in the skilled facility, so that we were not, adding to the burden of the skilled facility of, being out in the community and coming in. And it added burden to the skilled facilities, but for the short run, but on the long run, it was a way that we connected. And in fact, there were meetings this week about how are we going to continue some of this connectivity to our specialists, so that the skilled nursing patient doesn't have to go outside of the skilled facility and go to an office and wait and do all this transportation back and forth. And how do we do that? So I'm really pleased to say that our oncology department is going to work with our skilled people for people that are in oncology, and they're going to get these consults directly in skilled. So this short-term crisis of COVID, and I say short-term, we don't know how long that will be, but this crisis has created some innovation and gotten rid of obstacles of like, this can't be an obstacle. We have to let it move. How are we going to move forward? And that has been really amazing for me to watch. It's like things that might have taken a year to get implemented were implemented over a weekend, right? And like, why can we do that then, right? We're just really good at crisis when it comes to healthcare, aren't we?
Yeah, that's true. Now, you know that some people, and one of the challenges really is when some of these COVID patients are discharged from the hospital, they would still need to go to a skilled nursing facility. Have you had any challenges with transferring them from the acute care to a skilled?
We have. And so what we've done is we've worked jointly with the skilled facility leadership in each of the skilled facilities to better understand their processes from a CDC perspective. We've worked on processes with them where if they saw a spike in COVID employee exposure or a spike in patient exposure, working with them at reducing perhaps admissions during a time period till they felt comfortable that they had processes in place. We also have worked with them about with the Clark County Health District about getting supplies, because some people were caught off guard with not enough supplies. And then I don't know if any of you have had the experience of trying to go online and get some of those supplies.
Oh, no.
But if you have, you'll find that people will take your order and then they tell you, oh, it'll be June when you get it. It will be, and you're like, well, I just thought I put an order in that I was going to get next week, right, through Amazon. And that stuff really wasn't happening. It was really difficult. So we helped them to work with some local community, Clark County Health District, about how they could look at some surplus supplies to get those pieces there. But and then, just working with them with family members. One of the pieces that we asked the case managers to do was to have a very transparent conversation with somebody that was transferring to the skilled facilities to let them know that there may be risks involved. However, these are the things that we know and how to protect you and your family, and also to inform them that they would not be able to visit. Yeah. And that's very difficult because, as you know, some of our aging and elderly patients, that may be their last healthcare experience, right?
Yeah.
And so that's very hard for family members. So one of the things I thought was really innovative at a couple of the facilities, and I see many of the facilities doing that today, is they now have window wave buys. And I don't know if you've ever participated. I have a friend who's actually in a skilled facility, and about every other day we do that. The facility works with opening the blinds, and then people can get on the phone and they can still see each other through the window and be able to, add some compassion to their stay that is there, and let them know that they're still connected. Even though I can't put my arms around you, we still love you. You're still there. And I think that has been really incredible to me in this community of how they figured out how to keep compassion with healthcare. And so that's really, I've been very touched by that work that everybody's doing that way.
Yeah, that's true. I had the opportunity this last weekend to deliver masks to an assisted living facility. And, ironically, well, the caregivers did have masks, but the patients did not. And so when they were out in the bingo hall, they don't have any masks. So the administrator reached out to us and said, hey, can we get some masks for you guys? So we did, and we had to see the delivery through the door, the glass door, giving the caregivers giving the patients their masks, and that was really kind of nice. So
yeah, heartwarming to see that. Yeah,
heartwarming to see. What about case management and patient follow-up? How has that changed for you guys?
So again, we were given very short notice. Most of our case management. Well, we have three kinds of case management. We have an out-of-area team that really does everything telephonically. So this telephonic and being at a desk and not necessarily touching a patient was pretty normal for them. But they had to teach some of our medical management team that are used to going to the bedside and spending some time with the patient. How do we do this better? How do we communicate? How do we ask the right questions, right, during this time period? So we did some training with that. And then those people that were non-essential in case management going into the hospital were considered non-essential because they had their own staff within the hospital that we had to collaborate with in order to do this discharge planning piece and the follow-up piece and appointment piece. And we actually moved in about a week. We moved about 80 some people to a home environment. And most of those people have been working either telephonically or through home environment, just like my background here. We thought it would be, 30 days or so, and we're into 2 months. We'll just be starting back to coming back to office environment, or maybe venturing into the hospitals that are allowing visitors, because we're considered visitors in the hospital for this kind of work. Over a period of what we're calling waves, short waves, and how many people we're going to try to do that with so that we can really monitor where employees are. But the biggest piece for us was, we've always felt that the telephone was a very effective way to communicate with patients.
Right.
But we had to give a lot of instructions to patients to, first of all, pick up your phone. We will be calling you. It's not one of those calls looking for your vote. We really, really want to make sure that you understand that we're following up with you. We did some things with our telephone advice team as well, that they did a lot of outbound calling that we didn't normally do for just straight emergency room visits, to make sure that people really understood where they were and what's going on with their tests. But the telephone became very specific, and we had standard work procedures that we did with questioning, but we certainly added a lot of questioning to, what do you understand about COVID? What was your health literacy about that? Do you understand hand washing and what those pieces are? And really express the importance of quarantine during this time period. And it was pretty effective campaign, because we did not have large amounts of our population actually in the hospital, and they were avoiding hospital as much as they could. Now, I wish I could keep that process up for people that don't necessarily need to be in the hospital, and that's another day and another topic. But for today, that's what we had to do around COVID.
Yeah, that's good. That's good. What about like medication coverage? I know most of the seniors, they have to go pick up their stuff. Do you have any programs to help them out with those?
Yeah, so we had a couple of programs. We have a program already that you have a reduction in copays if you get 90-day worth supply. So we worked really hard to make sure that all the prescriptions that were out there had that 90-day supply piece of it, so that they reduced copays by 2 copays, I believe it is. For some of those with a 90-day supply, you only have to say 1 copay. So that was very helpful. We put our social workers, actually, they kind of volunteered. I said, how can we really help this community during this time period? So from about March 15th all the way through the end of April, we had a social worker that was 24 hours a day on call. For issues around medication issues, for finances, if there were housing issues that people were having. Because as you know, with unemployment, a lot of times grandma's house becomes the new house for everybody. So we had to talk about, how do you keep safe in this house now that you have generational people in your home, right? Children all the way to elderly people, and have those conversations. We also, we put together for all of the clinics, all the community resources on food banks and food resources, and making sure the kids understood that they could still get meals, because our seniors are impacted dollar-wise if they have families now moving into their home. So we created a lot of work around that, and including medication, because we knew people would start making decisions about food versus medication if we did not get information out to them. So
Right.
it's an ongoing battle to get people to understand what resources are out there. But that was one of the things that we did in place. And so we're back to normal referrals if people need that from a social work perspective. But that's what we did during that crisis piece to really try to help people out.
Fantastic. Yeah, I know you do have a lot of public informational programs out there, which I salute you for that. I appreciate that. I see that on TV all the time, and
Yeah.
it's very good, very good. Okay, so there has been, like we all know, an increase in unemployment during this pandemic, and how has that affected your company in what aspects?
So again, I've been Lisa and I are very lucky to work for Optum and United because during this period of time, our employees, if we could move them to home, we did. If we couldn't move them to home, we gave them protective devices. But people that were affected by COVID, they did not have to use their PTO time, their paid time off during this time period. And we helped our employees with child care subsidy. And in fact, it was a daily amount that was paid, and you could pay family members to help take care of childcare because that was one of the areas where we saw closures rapidly, right? Because usually it's the children that get more affected by a virus than the adults do, which is just sort of the opposite, right? With COVID today, I mean, children are affected, but certainly not at the rate that our elderly folks are.
Right,
and so we created, those people that were on the front line, as well as any employee that was talking about difficulty with travel. There were Uber expenses that were given at that time period. Expenses. We gave childcare subsidy during that time period, and we also, helped people with food and food bank kinds of issues. So from an unemployment perspective of our employees, it's been a very low rate. In the community, from an insurance perspective, as we see closures, and we've seen many restaurant closures, as you know, in our community, we've seen a reduction probably of some casino staff because of just reduction of the amount of people coming into casino rate to be able to do that. We worked for a month with the casino industry to do reduction in copays and finances to the casino. But I believe that we don't really know all the impact of unemployment yet. I think this is something that over the longer period of time we're going to have to figure out. I really wish I had a crystal ball that said how's this going to affect us in the long run. But if people are not employed, we're going to be looking at in our community with people going to where home is. Because for many people, Las Vegas isn't the first home; it's a second home or third home for people. I've been here over 25 years, so for me, Nevada, I feel like I'm a native Nevadan, although I'm not from this area. I feel like I am. So I think there will be people that will probably move during this time period. But I think that if COVID doesn't rage again, I think we're going to see, probably a peak of unemployment, and then I think we'll see a growth again. I keep telling everybody this too shall pass, right? But it's how we react to it and how we're able to manage through it. And we are a very resilient community in Nevada.
Yeah, that's for sure. That's for sure. Again, just referring back to the unemployment, the government has actually stepped up in giving some initiatives to everyone, like helping subsidize the employers' health insurance costs, covering COBRA, the stimulus package, the HEROES Act, the CARES Act. Do you think that these government intervention is going to act as a stabilizing force, or do you think it is acting as a stabilizing force?
I believe that it will help us in this crisis time. I think it'll be interesting to see over time how this will affect our unemployment. We hope that people are adapting that they're adapting to new ways of how they perhaps seek employment to be able to do that. So I think it will be sort of over time that we learn this. I think in the short run, putting the unemployment and the stimulus checks and being able to, look at subsidizing employees in larger companies or do that. The smaller companies, I think that we're going to see, unemployment in smaller companies, and that is concerning, for our community. But I think it's kind of over time that we look to see how that's going to stabilize our community.
Yeah, I'm hoping that too. Well, what about some U.S. officials have actually said that they are expecting the health insurance companies to cover vaccines when we do have, a vaccine. I'm hoping that's what I'm waiting for, without charging any copays once those vaccines are developed. Do you have an opinion on that, and what does where does Optum or United Healthcare stand on that?
So here's what I know about Optum and United in general. I know that they've been on the forefront of including some of the physicians that have worked in the organization have actually gone back to their old lives of vaccination development. And some of the physicians have actually moved in with the CDC folks to try to add more support on how, and with medication companies to figure out how we're going to do the vaccine. So I know that they're on the forefront of trying to figure out A, getting the vaccine, and then B, how that would be administering. I don't know about, I can't speak to whether or not the organization will apply copays or if they'll be free, or if from a CDC or a worldwide perspective, that's going to be an option for, all of us at some time. I do know that we are often on the forefront of preventative health, and this would be considered preventative health. So I wouldn't be surprised if it was, maybe reduction, maybe free, but I've not been given. I would love to have the secret sauce on that one, but I think everybody's really looking at
Right.
what's the expense. I mean, at the end of the day,
Yeah.
this health insurance company is a for-profit organization, and we do have stockholders that we have to report to. So I think they will be very fastidious in deciding how this is going to be administered. But I also know that they're in the forefront of how do we get it out and how do we do this from a preventative perspective. So I think more will will come about that decision. But I think it's going to be, how quickly can we get it out there and how can they mass produce it as fast to figure out how we're going to do that in the future.
Right. I'm hoping real soon.
Yeah, me too.
I don't think I'm going to fly until they have a vaccine.
There you go.
I don't know. But anyway, all right. So the coronavirus pandemic has forced CEOs, and some of the country's biggest payers, it has changed their approach to their leadership. Has that changed you somehow? Has this pandemic changed your leadership style?
So here's what I think has done is it's given the organization a better perspective of how to be flexible and how to be more transparent. I spoke earlier to Dr. Macbeth sort of being on the forefront of this piece, and leadership from the moment that we saw that there was a spike in COVID, he put a meeting together that continues every Tuesday now, but it was 3 times a week for a certain period of time at 7 a.m. in the morning. All leadership had to be there. They had to understand where we were from a statistics perspective, where we were from PPE perspective, and then what we were going to do for our workforce and how we were going to help our workforce. And so that was, I thought, incredibly innovative because it allowed leadership to say, here are the problems I'm encountering. Let's figure out what we're going to do with those problems. So they get a lot of this information from the ground up, from the leaders from the ground up, and then from the top down of how they were going to support us. What I see is also the corporation did some immediate things for leaders, because leaders like myself that perhaps are older and not younger leaders, we're so used to having this face-to-face contact. Yeah, having this face-to-face contact with our employees, it was an adjustment and a frustration to say, how am I going to get this information out to my employees in a succinct way, but how do I still stay connected with them? And the organization actually put and made it available many times for management to go and listen about flexibility, what kinds of statements you should be making, and how should you be supportive, and how do you learn and educate and stay connected to employees that are no longer in this face-to-face piece of it. I have my direct reports. One of the things that I've done with my direct reports is said, you need to help me make some of these decisions. And in the past, I think I would have said, here are some options that you have. Which options do you think you have? Now I say to them, we have to communicate with our employees. We have to keep them engaged. And how are we going to do this? What are your thoughts on this? And how are we going to do that? That I've tried really hard to engage my staff. And that is exactly what the organization seems to be doing, is how do we engage more? How do we not look at this as a barrier, but maybe an opportunity for us? And I think, that piece of, we always talk innovation, and innovation is one of our core values for United and Optum, but I think we've really embraced it during this time period because we've had to. And it's interesting how, sort of this crisis creates sort of innovation that's been able to do that. And I'm not going to say that it's still not a struggle for us to stay connected with our employees, but I think it's a work in progress that I think will be something that we value throughout the years to come.
Right. Well, thank you for that. Okay, you've spoken a lot about the programs for your employees and the other changes, the changes actually that your organization has done in this pandemic. Is there anything else that we didn't cover or talk about?
I think one of the things I want to talk a little bit about is, I think you and I talked a little bit about what do we need to convey, not only as a nurse, but what do we need to convey? And I think the piece that's taken away from this is, as nurses, especially as nurses, we have to use learning as an ongoing process. And this is an opportunity in this time period to get the facts and go to places for factual information that are distributing facts and not hearsay from yet another coworker or a peer, but what is the CDC telling us? What is the World Health Association telling us? What are the latest articles coming out? And to stay abreast with those. And I have a unique opportunity that we actually have a physician that is searching the literature throughout the nation about what we're doing for COVID and how we're managing that. So we get these snippets and these places to go. And I don't know that as a nurse I was necessarily that vigilant at this ongoing learning process, but I think that's one of the takeaways. The other piece is how the community has responded to the healthcare workers has been amazing to me. The gratefulness that people have regarding that piece. And every day, you should wake up and think about how grateful you are. And this has really done that for us as not only an organization, but me personally, about, I'm well, I'm not sick. I'm thankful for the things that I have. And I think that attitude of gratefulness has really made me a more positive leader during this time period, even amongst any of the opportunities or perhaps barriers that we may have had during this time period. So one of the pieces that I hope that we continue to do is say this too shall pass, but how it passes is how you adapt to it. So adaptation is going to be the mantra, I think, for many, many years to come for all of us in healthcare. And I hope that I can continue to adapt no matter how old I get, that I continue to adapt in this role. So I hope I can take that message away to everybody.
Thank you, Diane. That's a great message for the healthcare workers. So thanks for that. Um, what is your message to the public at this time?
I think the message to the public is COVID and other viral concerns is going to be here from now on. And that, we used to go, I always use this as an analogy. When I was younger, and for many of us that were younger, we used to go to the airport and we could meet mom and dad at the airport and we could go out to the gate and we could wave goodbye and we could spend all this time. And then a crisis occurred, 9/11, and we had to have Homeland Security. And now that we had to adapt to how that travel occurs, we have to go through security, it's for our safety. So for the public is make yourself the steward of yourself and your health. If the CDC and your physician are telling you it's the right thing to do to wear a mask, do that. You're only protecting yourself. Be the steward of your health, be the steward of what you can do for others' health, and really use hand washing and the distancing and the mask as part of your regular new norm. Because we've had to adapt. When we adapt to go to the airport, we can adapt to do this, and I believe we can do that as a public.
Yes. Thank you very much. And I do echo that because a lot of people, I think, don't realize that the virus is spread via respiratory droplets. And so washing your hands is not enough. Thank you for that message. I do echo that. So
Thank you.
Anything else you want to say?
Well, other than to thank you, Doris, for considering me worthy to be part of the podcast. I appreciate that. I do appreciate that so much. I hope that I've answered most of your questions as best that I could. And I want to thank you for this opportunity. Thank you very much.
You're welcome, but we would like to thank you for coming to the podcast and enlightening us about, how medical management has changed during this pandemic. And adaptation is a lot, and you have to think quick and adapt. And nurses are known for that, right?
Right. That's right.
So we do appreciate your expertise and your time. And global pandemics are unexpected phenomenon, but sometimes we still need to expect that they would happen. And we all, including the insurance industry, have to adapt to the ever-changing issues that this pandemic has brought. So thank you very much again.
Thank you.
You're welcome. And before we end today, I just want to let our listeners know that the PNANB has a couple of ongoing projects. And one of them is we have the Give to Nurses campaign, which is a partnership with Massage Envy. And Massage Envy is giving 1 hour massage or facial vouchers to the nurse frontliners. So if you don't already know about it, just go to the PNANB website and fill in the questionnaire, and we will vet you, make sure that you have taken care of COVID patients, and we'll give you the vouchers. So a relaxing thing. And the other one that really is near and dear to my heart, a project, and I hope we're asking you to support this, is our Masks and Shields project. We do understand that, this is still a need for the community. A lot of requests have come up, to us, not only from the acute care, but other areas as well. So our tagline is Masks on, Shields up, protecting Nevada together. So please support us. Go to our website and learn more about it. And thank you very much again, Diane. And thank you for tuning in to our listeners. We appreciate your continued support. This is Doris Bauer, your FILIPINARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you FILIPINARS, news and features about the Filipino-American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.